Today in the news, a judge is concerned about the virus rate in foster care in Texas, and the Navajo Nation calls for an investigation into the recent Fort Hood deaths, and of course the Dallas City Hospital Capacity Report. Today is September 8th, 2020, and this is Dallas Weekly News. Hello, I'm your host, Patrick Washington, and this is Dallas Weekly News. A federal judge said Friday that she is concerned about the high rate of coronavirus infections in the state's troubled foster care system. The Dallas Morning News reported court-ordered monitors say the positive test rate was at 20% in the late August. U.S. District Judge Janice Jack ruled in 2015 that the state foster care system was unconstitutionally broken and ordered sweeping reforms, which has also been partially upheld on appeal. Jack threatened Friday to hold the state agencies in contempt for disobeying those orders. There are nearly 11,000 children in what Texas calls permanent managing conservatorship. The rate of children testing positive for COVID-19 in the 7 days before August 28th was higher than 12% among all Texans, according to the court-appointed monitors. Jamie Masters, commissioner of the Texas Department of Family and State Health Services, told the judge that she could not explain the higher rate of positivity. On Friday, Texas reported more than 4,200 confirmed new coronavirus cases and 140 deaths. More than 13,000 people in Texas have died from COVID-19. The number of people hospitalized with the virus dropped below 4,000 for the first time since June. The actual number of cases in Texas could be higher because many people have not been tested, and studies suggest people can be infected and not feel sick. For most people, the coronavirus causes mild or moderate symptoms, such as fever and cough, that clear up in 2 to 3 weeks. For some, especially older adults and people with existing health conditions, it can cause more severe illness, including pneumonia and death. The Navajo Nation has joined calls for an accounting of the deaths at Fort Hood after one of its own members became the latest soldier from the U.S. Army post to die this year. According to officials at the Central Texas Post, Private Colton L. Chi, a 25-year-old soldier from Pine Hill, New Mexico, died Wednesday after he collapsed following a physical fitness training exercise 5 days earlier. He was the 28th soldier from Fort Hood to die this year, according to data obtained by the Associated Press. The Navajo Nation Council praised Chi in a statement Friday and urged the Army to thoroughly investigate his and the other soldiers' death. Army officials have said Chi's death is being investigated and that an autopsy would be performed by the Southwestern Institute of Forensic Sciences in Dallas. They said he died at a hospital near Fort Hood in the company of his family. Last week, the Army announced changes in the leadership at Fort Hood amid what they said was a widening investigation into the killing of another soldier at the post. A fellow soldier allegedly bludgeoning Specialist Vanessa Gillian to death which prompted calls for the military to change the way they handled sexual abuse and harassment. And now the City of Dallas's Hospital Capacity Report. This has been Dallas Weekly News. I'm your host, Patrick Washington. You can find these and more stories at dallasweekly.com. And of course, follow us on social media on Facebook, Instagram, YouTube, and Twitter. And as always, if you can, please stay home, stay safe, and we will see you again tomorrow.